Everyone. Today we are going to talk about regulation of iron absorption under the heading iron metabolism. So we eat food. That food contains heme iron and non-heme iron. So heme iron is in Fe2 plus state, whereas non-heme iron is in Fe3 plus state. Now this heme iron is absorbed into enterocyte. So this one is cell of our intestine, enterocyte, and here we have lumen, and here we have blood vessel. It is basically, this one is contraluminal side. Contraluminal side. So now this heme iron will be uptaken by this enterocyte by a protein called heme transporter, whereas this non-heme iron, that is in Fe3 plus state, will not be absorbed directly, but it needs to be reduced into Fe2 plus. So Fe2 plus, via this reduction is done by duodenal cytochrome B. After being reduced, this Fe2 plus is taken via DMT. Now this DMT stands for divalent metal transporter. This type 1, type 1, type 1. So now we have Fe2 plus inside our duodenal cell, this Fe2 plus inside our duodenal cell. Now what happens is, this needs to reach circulation before it's reach to liver or red cell progenitors for synthesis of hemoglobin. Now, so this process is carried out by protein called ferroportin type 1. This will help in transportation of this iron Fe2 plus from inside the cell to circulation. Meanwhile, at the same time, this process is coupled with oxidation of Fe2 plus to Fe3 plus via protein hepaestin. Now this Fe3 plus reaches circulation and bind with plasma transferrin. Now after being bound with plasma transferrin, iron reaches liver and red cell progenitors. Okay, so this is how iron is absorbed from our food into duodenum and from duodenum into our blood circulation. But if we have high levels of iron already in our body and we don't want this iron to be absorbed in our circulation, then how it is regulated? So it happens as high levels of iron in liver produces a protein called hepcidin. Now this hepcidin will inhibit ferroportin transporter. So there will be no more transportation of iron from inside the cell to the circulation, and then the iron absorbed will remain into this cell as mucosal iron named ferritin. And these iron stores will be stopped by when this cell will be shedding of epithelium lead to loss of all these stores which we don't need because we already have high stores in our circulation. So I guess this is all about regulation of iron absorption in our body. If you have any confusion, please feel free to write in comment. Thank you and have a nice day.